Medical Tactile Incorporated presents a clinical training video for the SureTouch system narrated by Dr. Carrie Kaufman. The use of these videos is strictly for demonstration of and the clinical training on the SureTouch visual mapping system by Medical Tactile Incorporated. The use or reproduction of these videos for any other purpose is expressly prohibited without the approval of Medical Tactile. Our first patient is a female with no palpable masses noted on her clinical breast examination. The patient underwent a SureTouch screening examination of both breasts. And based on the screening examination findings, a focal examination is performed on the lower inner quadrant of the right breast in the general area of the number 1 marker. So let's listen in on Dr. Kaufman's thought process as he goes through the SureTouch examination.
Now we see a series of exams here, and they relate to this area 1, 2, and 3. It turns out that 2 is a screening exam that looks at this area and screens back and forth and ends up finding a mass at number 1's location. So I think it's useful to look at number 2, 2.1 first. Now let's look at this video. Now, as we watch it, it looks as though that might have been something. There's several small waves. There's something right there. As we were scrolling back and forth here, there's something there, but then there's smaller waves. There's a big one there, and some other smaller ones. There's a big one there, smaller. Let's see that again. As we scroll around, we don't see much, but then we had something that came by there. Now we go back the other way, expecting that there it comes again. Now if we go back the other way, there it comes again, and there it comes again. And the skill of the examiner is to scroll by a mass, to see it each time, and then try to center it in your field. So again, all of these little spots, except for that one, are normal glandular nodular tissue, but that certainly is something. Now if it was artifact, as we went by again, we wouldn't see it, but there we saw it just then, and here it comes again. We're centering it right there. So, and our accumulated image on the right has recognized that we came across this enough times with enough pressure that we have a lesion. Now, our screening exam shows that the lesion is about 12 by 5, but it is hard, and it shows up as one peak. I think it's useful for us to note our system settings at this point. Right here it says that we're measuring the size at 40%, which is correct. The exam force was in a reasonable force. And if we go to the system, we see our kilopascal pressure is up to 25. And so that's a good screening level. And to see a peak that we did in the last screening test, screening exam, suggests that it's a real peak if it got into the red at 25. But now we would go back to the diagnostic mode at 20 and go back and review our diagnostic mode. So now we're going to look at the target lesion. Now we might as well just take, here's 1.1, and let's look first at centering the transducer over the mass that we've just screened for. Centering the transducer, let's see what we see. With the transducer centered over the mass, we're keeping it in vision here. Hopefully our accumulated image will get an accurate picture. And to screen this, we see that actually this seems to be a single peak, and it turns out that our reader, our SureTouch reader, identifies this as a single peak, but it has somewhat of a broad base to it. And as we watch it, it has a little bit of a shoulder down here, maybe a shoulder over there. This may not be a simple single peak. It's a little bit broader on the tip of the mass. It's a little bit broader here than a typical cyst or a benign fibroadenoma. But it might be a lobulated fibroadenoma. And either way, it may be slightly lobulated. There's a, look at that right there, and there. A shoulder, slightly lobulated, slightly multiple peaked lesion, or it could be just a single peak lesion. It measures out at 18 by 14, which is slightly bigger than our screening exam. But again, this is a diagnostic exam, and we would expect it to be a little bit more accurate. And it's 5 hardness and one peak, and it's located right here. I'm not going to go into these, but just to briefly tell you, these show the very similar thing. Here, a little bit of a shoulder that didn't show up as one peak, but a little bit broad-based tip. And here's another exam of the same area. Again, very consistent between the 3 exams, which is what you want. You want to examine something over and over to be sure you've gotten a good exam. And all 3 of these exams, 1.1, 1.2, and 1.3, all essentially show us the same thing. A slightly broader tipped, peaked area, maybe some shoulder on the edges, maybe some shoulder here, slightly multi-lobulated or multiple peaked, but primarily a single peaked lesion, which is very hard and certainly a dominant mass.
Medical Tactile would like to extend our sincere appreciation to Dr. Carrie Kaufman, the medical director at Bellingham Breast Center in Bellingham, Washington, for his time and participation in this video. You can find out more information about the SureTouch visual mapping system and Medical Tactile Incorporated at our website at www.medicaltactile.com. Thank you.